right after. We'll first.
The Workforce Development Committee will come to order. We don't have quorum yet, but we have some bills that we'll be hearing this morning. And so the first bill on the committee is House File 4170, Chair Hassan. And so Chair Hassan will move the House File.
Mr. Chair, I don't see my testifiers yet. You want to take up the next bill?
Representative Frazier, are you ready to go?
I believe so.
Okay, we will move the House File 3849. And the Representative Frazier will move that House File 3849 be laid over for possible inclusion. Good morning, Representative Frazier, to your bill.
So let me pull up my notes, Chair.
Oh, we do. Yeah, we do have work.
No, he'll call.
Do we have quorum?
Good morning. Yeah. Did you have a long night? Thank you.
Chair, which bill are we on again?
We are on 3849, the Jobs Foundation bill.
3 in the morning.
Thank you.
Really appreciate it.
Hey, man, I need
And
to
you look good. No sleep. Look at this. No sleep.
Go ahead, Representative Frazier.
Help you guys feel sleep.
Thank you, Mr. Chair. This bill supports Jobs Foundation Repowered and specifically their work readiness program for previously incarcerated individuals. Repowered has been serving Minnesota's reentry community since 2011, and this is their first appropriation ask, so I'm excited to be here to be a part of that. Their program is unique in that it starts with paid employment for full benefits for up to 18 months. Paid employment is a critical component to successful reentry. You know, I often talk, I work a lot in the public safety space, and I talk a lot about having a smooth reentry for our folks that are coming back to the community, and this program does just that. Repowered is seeking funding to support their direct training and service costs, safety enhancement, and economic support to assist in offsetting the paid work experience of up to 18 months of the program. Safety enhancements include items such as forklift maintenance for forklifts used in work readiness training, tools for improved heavy material handling, and expanding safety training software to expand training. The economic support includes helping offset the portion of wages not covered by the social enterprise. About 30% of wages paid to work readiness employees represents a cost of program participation and should be covered by contributed income. Repowered is also one of a few programs that serve women and registry-involved individuals, and they do this all with impressive results. 70% of Repowered's work readiness employees graduate with employment secured, earning higher wages than they would have without this program. And their recidivism rate for 2023 was just 4% as compared to an average of 24% in the state of Minnesota. I really hope that we can find support for this proven and effective program. This organization does get results by clearly developing employable individuals, and it helps in strengthening individuals that in turn strengthen our communities. And I do have a few testifiers.
Welcome to committee. Please identify yourself for the record and share your pronouns if you like, and proceed with your testimony.
Esteemed representatives, thank you for your time today. My name is Heather Walsh. I am the CEO of Repowered. We are a nonprofit employment social enterprise under Jobs Foundation. Our mission is to transform lives by providing practical work experience for people facing barriers to employment and supplement that work experience with skills training and personal development to prepare them to be more valuable employees with expanding futures. We accomplish this by employing previously incarcerated individuals in our 91,000 square foot electronics recycling, data destruction, and refurbishing facility. Here they earn wages while stabilizing their lives, learning new skills, and developing a plan for a future career. They meet one-on-one weekly with their work-life navigator, have comprehensive support services available, participate in weekly trainings, and engage in a supportive, collaborative environment as an employee. We fiercely believe that all people are defined by their future and not their past. Repowered is also committed to continuous improvement. In 2021, 28% of our work readiness employees completed the first 90 days of the program. In 2022, that was 62%, and in 2023, it was 81%. While the first 90 days are critical as an indicator for individual success, The employees can stay up to 18 months. This appropriation is our first ask ever, and it is to fund direct training, services, safety enhancements, and overall economic support. With this program, we unlock hope and opportunity, allowing talented individuals to build confidence, break the cycle of recidivism, and rebuild their lives. Thank you.
Thank you. I see you have another testifier, Representative Frazier.
That's correct.
Yeah. Oh, that's, I'm just.
This is right.
Yeah. My fault.
Welcome to the committee. Please identify yourself for the record and share your pronouns if you'd like, and proceed with the testimony.
Thank you, Mr. Chair. My name is Eli Ellis Simmons. I am in Repowered's Work Readiness Program. It's been a great place to work there. They have opportunities for everyone, opportunities for the educated, for the uneducated, for the gifted, for the ungifted, and opportunities for second chances. So I'm happy to be a part of that. Also, they offer you counseling and therapy and different programs to help prepare you for the work world. Kind of similar to when Humpty Dumpty was on the wall and he fell off, nobody could put him back together again. So I'm thankful and grateful for the position that Repowered has that help push you back together and give you that position on the wall so all the King's people can see that progress is adequate. I'm just so grateful for this opportunity, and I hope that I can continue to grow and develop as I move on or stay there, because they also prepare you for those positions as well. Whichever comes first, and just to continue to have those abilities to do the things that I need and the things to get the things done that I can do.
Thank you for sharing your stories. Discussions. Representative Weems.
Thank you, Mr. Chair. Thank you, Rep. Frazier. Thank you, Mr. Ellis and Ms. Walsh. This sounds exciting. I work a lot with veterans that get sideways with the law. And two of the things that we do for them, one is reintegration. The other one is the restoration piece. And the restoration piece is probably the more difficult because you want to be restored to your community, your family, maybe those that you had a problem with. And I think your program here, Repowered, has a good track record. I see that you have a one-on-one, I think it's a mentorship. If you could describe how that process works at a mentorship program. Thank you.
Good testifier.
Thank you, Chair. Yeah, we have it's a weekly one-on-one meeting with your work-life navigator, and obviously that conversation changes as you move through the program. The first 90 days, the focus of those conversations is really around stability and stabilizing your life. Much of that is around relationships, but we're focusing on housing stability and food security and transportation, the basic needs to be successful. The conversation then shifts to what skills as an individual you want to build and grow, and then the conversation changes to developing resumes and job searching and interview skills and mock interviews. So that changes. I would expand on your comment that relationships are absolutely critical to the support of the individuals in our program. And relationships are difficult when you're reentering society. So we actually have on-site mental health therapy on the first 90 days. Those programs are required weekly. They deal with things like change management, managing through change, stress, dealing with difficult relationships. In addition to the group therapy, all of our participants have opportunities to meet one-on-one with therapists weekly to really dive into those relationships and how to manage those relationships. Some of the most difficult are those relationships with your children. And rebuilding those and redefining what those mean. And we provide assistance through the therapist.
Representative Weems.
Thank you, Mr. Chair. Thank you, Ms. Walsh. And the mental health piece, thanks for touching base on that, because it's across the board in our society. We're seeing that there's more things that we don't understand about ourselves, and we need to come to an understanding. And if I can just quote Carl Jung, this is my Carl Jung quote for the day. Who looks outside dreams, who looks inside awakens. So thank you, Ms. Walsh.
Representative Zalesnikar?
Thank you, Chair, and thank you, Representative. I think this is a fantastic program, and I guess my question is, I see the area that you serve. Has there been any expansion, or I'm just curious if this program or one like this is available outside of this scope that you've listed?
The testifier.
Yeah, a few years ago, we expanded the number of people that we served, and what we found was the quality of the program went down, and the participants didn't stay with us as long to get to the point where they were ready to jump to their next career. So from a volume standpoint, we've right-sized the program to make sure that we have the highest quality program that we can. If your question is geographical, we have not looked at that primarily because the work experience we're providing for individuals is electronic recycling. It is a large facility. It is hard work.
Yeah.
And that is not as mobile, right? So we're tied to St. Paul because our facility is in St. Paul. But we serve about 80% of our participants come from Ramsey and Hennepin County. So that does address 20% of individuals who are outside of those two counties.
Representative Zalesnikar.
Thank you, Chair, and thank you. Good job. It's just nice to see the mentorship and the relationship building. I think that's essential to have the success and to acquire the skills and the confidence and the self-esteem and repair, rebuild framework with a group that has common goals and can move through a process in a meaningful way. So congratulations and thank you.
Representative Harder.
Thank you, Chair Zong. I have two questions, and this is for you, Heather. My first question, because I can't seem to find it, is how long has Repowered been around? And my second question is, prior to coming to ask for your first round of tax dollars for your programs, how have your programs been funded in the past? Thank you.
Your testifier.
The Jobs Foundation has been around since 2011, and we have built the electronics business to provide work training around 2012. So we have been around. You may have known us as Tech Dump. We rebranded in 2022 as Repowered to move forward and to support our vision going forward. And what was your second question?
Representative Harder.
Thank you, Chair Zong. The second question is, this is your first time asking for taxpayer dollars, so I'm curious how your programs have been funded in the past. Thank you.
Your testifier.
Yes, excellent question. So we are a social enterprise. So in that recycling, refurbishing business, we take in recycled materials, we salvage electronics, and we refurbish them and we resell them. So we are generating a revenue, and that revenue has covered our program completely until 2021 when we grew substantially. And at that point, we did receive a couple $100,000 in grants. Since then, we've had to change our model as the market has changed, and the enterprise side of the business has not been able to fully fund our program, our work readiness program. So we are reaching out this year heavily on grants, this appropriation, and individual donors.
Representative Harder. Further discussion. Is there one more testifier? I believe we have another testifier who just arrived, so if you could keep it very brief because we have to move to our next bills. So welcome to the committee. Please identify yourself for the record and share your pronouns if you'd like, and proceed with your testimony.
Thank you, Mr. Chair. My name is Shannon Hayden. I started at Repowered in the Work Readiness Program in 2021. When I graduated, I was hired full-time as the Facilities and Resources Coordinator, which brings me great joy to help other people. Since graduation, I've hit many milestones that I would have never believed were a possibility. The program has been a blessing. I started out on the line not sure what I was going to do in my future and in my life. With this program and the people around me, it wasn't long before I began to flourish and believe in myself again. I began to believe that whatever I put my mind to, I could accomplish. Even as an employee, I felt supported and loved being part of this team, a team that encourages others to flourish. Since graduation, I have made many accomplishments. I am proud to be able to provide for my large family. I have 9 people in my home. And most recently, I've begun the process of becoming a homeowner, and I'm just waiting to sign my purchase agreement, something I never thought I would have been able to do before Repowered. Our organization supports everyone who works with us with resources and opportunities that you can't find in other jobs. We give the encouragement and support needed to be able to move forward in a better life as successful and not with the prison mentality. Thank you for your time and listening to me.
Thank you for sharing the stories. Closing comments, Representative Frazier.
Thank you, Mr. Chair, and thank you, committee, for the good questions. And Mr. Chair, thank you for hearing the bill. I think I'll just end with adding on to what Representative Wayne said. Restoration, restore people, restore communities, and this program does that. Thank you.
Thank you. We do have to move some minutes, so if I could get a motion to approve the minutes from March 13th. Representative Hassan, would you
So
move?
moved, Mr. Chair.
All those in favor of approving the minutes, say aye.
Aye.
Opposed, motion prevails, minutes are approved. Next is House File 3850, Representative Frazier, the hired bill. Welcome to committee. Again, Representative Frazier, and to your testifiers.
Thank you, Mr. Chair. Glad to still be here for one more bill. House File 3850 is a bill for funding for Hired. Hired is a workforce development nonprofit that works in community to connect job seekers to employers across the Twin Cities. Hired has been around since 1968 and has helped many thousands of Minnesotans prepare for the workforce and to find good-paying jobs. In 2023, Hired worked with more than 3,700 people and helped over 1,000 of them find jobs. This Hired bill seeks $280,000 to provide career retention services for Minnesotans with low incomes who have just landed a job so they can keep their job and thrive. Hired is aiming to help people make a stable transition to employment, increasing the chances for job retention, advancement, and career growth. Hired has a track record of helping Black and brown people prepare for and get jobs. And they're seeking funding for intensive job retention services for these same people during that fragile transition to work when a new job can present new barriers to success or resurface old barriers. I'm looking forward to helping them continue to have resources to do this good work. And with that, Mr. Chair, I have a couple of testifiers.
Welcome to committee. Please identify yourself for the record, share your pronouns if you'd like, and proceed with your testimony.
Good morning. Thank you, Chair Zhang and members of the committee. My name is Julie Brecky. I'm the Executive Director at Hired, and I'm really happy to be with you here today. As you may know, Hired is a multi-service workforce development nonprofit, and our work centers on one thing, helping prepare people to be successful for employment and grow, actually, into securing good jobs with family-sustaining wages, benefits, and chances to advance. Hired works with people and families across the Twin Cities, and we support individuals whose employment opportunities have been systemically, historically, or situationally impacted by barriers. We build trusting relationships with each person we work with, and last year we worked with 3,734 individuals. All of those were low income, 72% identified as BIPOC, people of color, 72% identified as women, and there were more than 8,200 children in the families that we served last year. Hired helped 1,010 people find a job last year with an average wage of $23.54 an hour, and that's just under $49,000 a year. Last year, you and the Senate approved our first direct appropriation to help us serve more people in our successful short-term career pathway training, and I'm so happy to say that we're making incredibly great progress there. We have reached, 30% of the job placement goal, and we're only a quarter into the contract. Today, I'm asking that you consider a completely different bill, that Representative Frazier described, but equally important, support for intensive job retention services. Getting people ready for work is critically important, and helping people keep their job, stabilize, and advance in their career is equally important. Hired is able to provide individualized coaching and support for the people that we work with during our training and job placement work, but the majority of our funding allows for only once-a-month contact after job placement. We've learned that over time, the transition to employment can be fragile, sometimes resurfacing old barriers to success or creating new ones, barriers that can lead to people losing their jobs. And we're convinced that if we can continue to offer services as people start their job, they will have a better chance of navigating challenges, keeping their job, and growing a career. In December, Hired wrapped up a job retention pilot project with Medtronic, helping to elevate worker voice and lower turnover rates for their second and third shift battery assembler roles. We had an employment navigator on site for employees to connect with on a range of non-HR related issues that, if not addressed, could jeopardize their job. Jamin Cook is you'll be hearing from in a second here. He is a manager that we worked really closely with, and he'd like to be here today in person, but he works a third shift, so he submitted video testimony. And he can describe the impact of that work much better than I can, so here we go.
My name is Jamin Cook. I live in Minneapolis, Minnesota. I'm a third shift supervisor at Medtronic facility in the Brooklyn Center. I'm here today to testify in support of House File 3850 and Senate File 4028. I'm very, very excited about the partnership with Hired. At the beginning of our retention pilot program, Hired came in throughout third shift. They came in between 10 and 6 a.m. They would come in at 10 p.m., 3 a.m., and or 5 a.m. To figure out barriers that were keeping some operators from having good attendance and being successful on third shift. It was pretty rough at first because we were trying to figure out how we could support third shift. But things really took off when Hired was able to have a consistent on-site presence. 2 days a week, Hired staff member Don Tremarco would be on site. She really had a significant impact on our shift. She started to connect with people on second and third shift. She took calls outside of their work hours, and then she also gave us some feedback on what we should be paying attention to with some of our operators. It really helped when Hired had a lot of resources that they could help staff who were struggling with barriers like transportation, food, childcare. Those are some of the main things that they could help out with. Others wanted third-party conversations where they can go in and just talk to staff, and Don was really supportive of that. Some people really struggle with food because sometimes the lines will be down for about a week and they weren't being paid, or they might not have enough food at home. So it really helped us as supervisors to have Hired give us some gift cards that we can give out to people who we knew were struggling to help them get through, through the week or through the pay period until they got paid. Sometimes it was just, gift cards that we could recognize staff members for having excellent attendance or doing excellent work. Seeing people and their contributions is so important, and we wanted to make sure we recognize that. We had many workers come in early just to meet with Hired staff before their shift. On days Hired wasn't there, I had a lot of people coming and asking when they were coming back. I heard many times like, man, they should be here every day. So I had people, I had a lot of operators who were on their final written warnings, and because of Hired staff, because they were able to step in, we were able to address those personal challenges and help them keep their jobs. Hired held a bunch of sessions to get feedback from some of our operators, just to kind of help them be more successful with their relationship with them. Unfortunately, I was not able to sit on those sessions, but what came out of those sessions was, operators felt like Hired and Medtronic really cared about them. Having people willing to work outside of their normal hours, stop being on third shift, it meant a lot to the operators and the supervisors. This project made a big difference, in how we could support second and third shift workers and improve retention. I really encourage the state partners, the state to partner with Hired so that more workers could benefit from Hired and their support. Thank you, I appreciate it.
All right, discussion. Representative Weems.
Thank you, Chair Zhang. Thank you, Rep. Frazier. Ms. Brecky, what's in the secret sauce? How did you do it? When I take a look at, you know, the 990s and I take a look at the charitable giving ratio, you are at the top. And before I have you answer that question, I see that we've got the pages out here, and I just wanted to explain what the charitable giving ratio is. For nonprofits, when they file their nonprofit status, they do a form which shows how much money they've received from contributors, and then how much of that money was actually directed towards their mission. In this particular case, it's for those people that are getting workforce-type training. And 99%, that's at the top. So please, tell me what's in the secret sauce.
It's simple. I'm just kidding.
It's simple.
To the testifier.
Thank you, Chair Zhang. You know, I think, I'm not exactly sure the question you're asking, how we operate so leanly and.
Yes.
Okay.
Exactly.
You know, that's a really great question. You know, we really, whenever we possibly can, we're investing in program and people. We work with nearly 4,000 people a year, and the relationships that we create one-on-one with individuals is where the magic happens. That's the secret sauce. I'm happy to say that, you know, this gets into some wonky stuff of running a nonprofit, but we reinvested in our technology infrastructure, all of our software. We went from having 6 people in our IT department down to 1. We had 6 people in finance, we're down to 3. We are lean, we're using technology efficiently in all of our work, not only our operations, but in program. I would like to talk a little bit more about what we'd like to do with this direct appropriation if we have time. I'm not sure we do, but it's all about testing a model of continuing to have a place-based strategy or follow people who've been employed regardless of employer, gather data and make a case for what the ROI is to employers, to funders. We'd like to see this as potentially an earned revenue stream at some point, but we don't have data. We have one great experience with Medtronic that was based on a hunch with federal national funding, a national foundation called Workforce Matters, funded that Medtronic pilot. And we see so much promise there. We work so hard to get people placed, and we know that if we can help people make it past 90 days, they're going to really grow in that job. They're not going to be back looking for another job and not gaining the traction of having increased wages, medical benefits, and a chance to build wealth.
Representative Weems.
Thank you, Chair. Thank you for that answer.
Representative Zalesnikar.
I'm good.
You're good. Representative Harder.
Thank you, Chair Zhang. My question is for the Executive Director. Can you tell me how many times you've come to this committee asking for taxpayer dollars for your program? Thank you.
Yes, I
To the
can.
testifier.
Thank you very much. This is our second time. Last year was our first time. We really saw the need with the worker shortage and partnering with employers to grow the really successful career pathway model. It's a short-term training thing. This is completely different, and it is our second time. The $280,000 request is carefully, well, I think we're pretty prudent and frugal in putting together our program budgets and managing programs, making sure they have enough resource to succeed. This would allow 2 career navigators and a pool of funds to meet those challenges that could be destabilizing for someone in their job, so support services. So it really is the lion's share of that, and it's a great question. I appreciate the question.
Representative Harder. Further discussion. Seeing none, closing statement.
Thank you, Mr. Chair, and thank you for being here to help testify and talk about the program. It's a good program. I think you know, our job here as elected officials, we're paid by the taxpayers to do this work. We're paid to make good decisions. We're paid to represent our constituents, and this is a good use of resources of our taxpayer dollars. So, looking forward to helping support this organization.
Representative Frazier will renew his motion on House File 3850, be later for possible inclusion. Thank you, Representative Frazier, and to the testifiers. Next is House File 4170, Representative Hassan, Inspired Change Clinic. Good morning, Representative Hassan. You will move that House File 4170 be later for possible inclusion. To your bill, Representative Hassan.
Good morning, Mr. Chair and members of the committee. Today we have House File 4170, which is an appropriation to Inspire Change Clinics Healthcare Fellowship Program. This program is designed to create pathways to medicine for high school and college students interested in pursuing a career in healthcare workforce. Studies show that racial, ethnic, and gender diversity among healthcare professionals promote better access to healthcare, improve healthcare quality for underserved populations, and better meets the healthcare needs of our increasingly diverse population. According to Minnesota Board of Medical Practice and U.S. Census of 2020, Minnesota's physician workforce, like that in many states, doesn't accurately reflect the racial and ethnic demographics of the state. Minnesota's population is 83% white, and the physician workforce is 76% white. For the racial and ethnic groups, however, the disparity is great. Minnesota's population is 7.4% black, but the physician workforce is only 2.6% black. Indigenous people make up about 1.4% of the state's population, but only 0.2% of the physician workforce. Black, Hispanic, Latino, indigenous students remain underrepresented among medical school enrollees compared with the U.S. population without significant change since 2009. In December 2020, the Minnesota Medical Association Board of Trustees commissioned a task force to examine the barriers in medical education, residence training, and licensure process that affect supply and distribution of Black and Indigenous and other underrepresented people in medicine. The task force identified 3 primary barriers. The number 1 barrier is lack of exposure, and that's why we're here today. That's why we need people who are in these fields, who are from the BIPOC communities, to step up and create a possibility for students or a chance to explore if they're interested in these careers. And that's why we have Inspire Clinic with us today. Mr. Chair, I have testifiers, and we'll stand for questions. Thank you.
Welcome to the committee. Please state your name for the record, share your pronouns if you'd like, and proceed with your testimony.
Thank you, Chair Zhang and esteemed representatives. My name is Hassan, and I am a program participant. Coming from a disadvantaged background, I've had to navigate the educational system largely on my own. I researched endlessly in high school to figure out what classes I should take, how to score well on college entrance exams, and what it takes to get into a good college. This made the process of college admissions much more difficult for me because, unlike my peers, I had no family members to reach out to or connections that would aid me in this process. Although I managed to figure out the college admissions process on my own, it turns out that the medical school admissions process is a completely different ballgame. One of the most important parts of a medical school application is clinical hours, and going to a smaller liberal arts school, it was incredibly difficult to find opportunities within the area that would allow me to interact with patients. I ended up reaching out to the Inspire Change Clinic leaders a year ago to see if there were any programs that they knew of that would help me gain clinical experience. They connected me to the director of My Life, My Story, a program that focuses on writing patients' life stories, to allow providers to learn more about their patients. As an English major who loves to write, this program was perfect for me, but I wouldn't have been able to find it without their help. I had never previously heard of the program, and neither had the internship directors at my college that I was working with. They also asked me to volunteer with them at upcoming health fairs, and through that, I met a doctor that I shadowed with. For disadvantaged students like myself, it is incredibly important to make connections within our field of interest to advance our careers, and a program that focuses on the advancement of disadvantaged students would help diversify the field of medicine so that all patients can find representation within their healthcare providers. Thank you.
Thank you. Do you have another testifier, Representative Hassan?
Yes.
Welcome to committee. Please identify yourself for the record. Share your pronouns if you'd like, and proceed with your testimony.
Thank you, Chairman and esteemed representatives, for having me. My name is Nasra Ali. I'm a senior in high school, and I would like to share a little about myself and how Inspire Change has helped shape my future. When an old tree falls, some people see it as a tragedy. However, unseen from the carcass of the tree, mushrooms bloom, slowly decaying the remnants, allowing for new life to flourish. In many ways, my life has been like a seed sprouting out of decay. At a young age, I started to resent my circumstances and wished for the lives of my peers. I was never fortunate enough to have access to the same resources as my affluent classmates. I began to doubt my capabilities, believing my path was already carved for me. I could no longer envision my dream of becoming a doctor, until I met Inspire Change leaders at a community health fair. They sparked my interest again, and I began to regularly attend their weekly meetings where I was exposed to hands-on experience in college prep. They helped me to recognize my worth and even started checking in on me regularly. After years of compartmentalizing my life as an act of self-preservation, old ambitions began to reawaken. Thanks to this amazing organization, I have found solace in volunteering and community outreach. Through the Inspired Change program, I have gained a positive outlook on life, and I am now always in search of education and health. This graduation cycle, I will be rewarded with the International Baccalaureate diploma, and I aspire to enlighten my community the same way I have been. Through Inspired Change, I have had the opportunity to promote youth health literacy, and I have made amazing, healthy relationships. And with their support, I have grown from a timid sprout into a sapling. Just as a single tree cannot flourish by itself, my growth has required the strength of others. Despite the challenges I have faced in my forest of a life, I feel confident that my tree will not only strengthen, but encourage growth in others. Thank you.
Thank you. And I believe you have a video testimony?
Yes, we have a video, Mr. Chair. Let me see if I can turn that.
Hello, and thank you to all the committee members for this opportunity. Thank you, Representative Hassan, for authoring this very important bill. My name is Shukri Jamali. I'm a nurse leader here in the Twin Cities and a member of the Inspired Change Board of Directors. I'm very excited to share with you our program that aims to address the pressing issue of healthcare staffing shortage. Our goal is to enrich the future healthcare workforce with a robust mentorship program that provides guidance and support to up to 80 students each year as they pursue a career in the medical field. The fellowship program caters to both adolescents preparing for college applications and college students seeking direction in their career path. The program offers a special opportunity for teenagers and young adults to learn about different career paths and get support from professionals already in the field. Students also receive individualized assistance from a guidance counselor to access resources otherwise unknown to them. Throughout the quarter, students take part in various activities like a mentorship session, hands-on experience, skill-building workshop, and a community-building event to learn, grow, and connect with others who share their interests. We believe through this program, students will not only become the healthcare workforce of tomorrow, but also gain the skills needed to pursue their career aspirations and college aspirations. By nurturing and guiding these future healthcare professionals, we want to create a more inclusive and vibrant healthcare workforce environment. Although we've been fortunate enough to mentor a few students the past few years, with this structured program, we're confident in our capacity to enroll and provide assistance to as many as 80 students in the first year. You can rest assured that this program also has stringent criteria to identify and enroll students who lack mentorship connections and provide them with the opportunity to explore the healthcare field on an equal footing with their peers. I take pride on serving on this board and eagerly anticipate the chance to continue to positively impact students across the state of Minnesota. Thank you.
Welcome to committee. Please identify yourself for the record. Share your pronouns if you'd like, and proceed with your testimony.
Thank you for having us. My name is Munira Malamisak, and I am the CEO of Inspired Change. And I'm here to answer any questions that may come up.
Discussions? Representative Harder.
Thank you, Chair Zhang. And my question is for the CEO, because I'm looking on your website. How long have you been in existence?
That's a good question. So prior, oh, sorry.
Proceed.
Thank you. Thank you, Mr. Chair. That is a good question. For Inspired Changes in NEO, we did a lot of our work through Brighter Health Minnesota, which was a consultation organization, LLC. This came out of nowhere. 2 years ago, we started having students just asking us questions, parents coming up to us, and the nonprofit side is pretty new. So I would say about the last 4 or 5 months, we've done it under Inspired Change, but beforehand, it was just through volunteering and our consultation business. With that, I am a family nurse practitioner at a large hospital or clinic in Minnesota, and we've got another nurse practitioner on our team, and we did a lot of work for health equity and have seen a lot of the disparities. And through those disparities, one of the things that we've realized is having brown and doctors that look like you or nurses that look like you is really helpful, especially when you're not feeling well. And we have been working to get more students out there, train them, help them get the certifications that they may need, and share our knowledge with them.
Representative Harder.
Thank you, Chair Zhang. And then my next question is that you're asking for $1 million?
Yes.
Will this fund the entire program, or do you have other organizations helping you as well?
So we
That's
have,
fire.
oh, sorry, I keep forgetting that. I apologize. Mr. Chair, our plan is we've got parents who have donated over $200,000, sort of said we'll donate for that. And we're planning on getting a location. Once we do, we're partnering with other organizations such as Metro State has already agreed to partner with us. We've got couple of other hospitals such as Children's Hospital and other places. And we are starting a place where we can let them teach them, and not only that, so that they can get the training that they need and the certification that they need, such as CNA, MA, and getting ready for their RN license, which is the NCLEX.
In our package, there's a letter from Metro State University too, so if members want to refer to that. Representative Harder?
That's all, thank you.
Further discussion to the bill? Representative Frazier.
Thank you, Mr. Chair, and thank you, Representative Hassan, for bringing the bill, and thank you, ma'am, for being here to testify and talk about this program. I was struck by when you talked about how it came about, and to me, that's always touching when you hear that the community was asking for something, you were there to provide a service, and now you are orienting in a way where you can do even more and create pathways into a profession that we all know, we need more people.
Right.
And we need more people that reflect the population that we're serving to deal with some of the inequities that we have in our system. So thank you for coming together. Thank you for listening to the community. Thank you for partnering with these other organizations that can help you get it done. And thank you for engaging the community to actually help invest in something that is going to be able to support the community. Thank you very much.
Thank you, appreciate that.
Closing comments, Representative Hassan.
Thank you, Mr. Chair. I want to leave you with this note. Young people do not need role models. Role models are people on TV. They need real models. Real models are people that can show you the way and can help you decide what your future looks like. What you don't know doesn't exist. And if these young people don't know any doctors in their community or any health professionals in their families, they cannot envision that life. Please support. It's a great bill. Thank you.
Can I add one thing, Mr. Chair? We recently just asked how many people would be interested in having a program, a long program, a year program, and just opened it up. And we had over 29 nurses who are interested in being mentored by us, 22 high school students, 11 nursing students who are interested in, one, figuring out how do I get a job at a hospital, what other trainings do I need, and what career should we go with.
Thank you. Representative Hassan renews her motion on House File 4170 be laid over for possible inclusion. Thank you for coming in today to the testifiers. Up next is House File 4131, Representative Sencer-Mura. Representative Sencer-Mura will move that House File 4131 be laid over for possible inclusion. Good morning, Representative Sencer-Mura, to your bill.
Good morning. Thank you, Chair Zhang and committee members. I am here today to present House File 4131 and ask that it be considered for possible inclusion in the committee's omnibus finance bill. I'm excited to talk about House File 4131 because I know that our committee has had various discussions about mental health and some of the barriers that mental health has for folks getting a job, maintaining a job, moving forward with their career. But what we also know is that having a job, having a stable income, having a place that you go every day, having something that keeps you going, that gets you out of bed in the morning, can actually support people's mental health, and that's what this bill is about. So this bill is about solidifying critical resources for employment supports for people with mental illness. Some of these Minnesotans live or work in my district, and some probably live or work in your district as well. There's a handout in the packet for today about this bill that details that the program received a one-time general fund increase last year of $5 million over the 24-25 biennium, or $2.5 million per year for the employment support services for people with mental illness, also known as the ESP program. This one-time funding enabled the state's network of provider organizations to serve more than 1,000 Minnesotans. The challenge is that when this one-time funding goes away at the end of fiscal year 25, because it was not ongoing, the providers will have no choice but to reduce their services by half, leaving 500 people without necessary and critical job assistance. So in a sense, this bill proposes that we shift the one-time $2.5 million annual appropriation from the general fund to the workforce development fund and make it part of the base funding so that it will be ongoing. This will free up $2.5 million in the general fund and instead use a dedicated source of funding for exactly what it was meant for, workforce development. To give you more definition of this ongoing need and why we need to make sure that these critical services can continue without any interruption, I have several testifiers today with me who can give you a face and a voice of the challenges and successes of the program. Thank you.
Welcome to the committee. Please identify yourself for the record. Share your pronouns if you'd like, and proceed with your testimony.
Good morning, Chair. My name is Robert Reedy, and thank you for hearing us today. Chair Zhang and esteemed members of the House Workforce Development and Finance Policy Committee, thank you for hearing us today on House File 4131. My name is Robert Reedy, and as Senior Director of Vocational Services at RISE, I have spent over 30 years dedicated to vocational services for individuals with disabilities. Sorry.
All right, take your time.
Yeah. With a focus over the last 2 decades supporting those with mental illness, mental health challenges through the individual placement and support model. I am representing a coalition of 22 IPS, or individual placement and support providers across Minnesota. We are united in our mission to ensure access to these critical services, a service that has garnered support from the governor's office, as will be further highlighted in his upcoming supplemental budget proposal. As you will hear from our other testifiers, the impact of IPS is profound. With a placement rate of 61%, surpassing the national average, we are making a tangible difference. Our reach currently extends to approximately 1,000 Minnesotans annually, underlying the need for expanded services, especially in BIPOC communities. Today, our discussion is centered on ensuring the sustainability of current IPS funding levels through a shift to the Workforce Development Fund. We deeply appreciate last year's support, which was instrumental in sustaining and expanding our services. This year, we seek to solidify this support, proposing a shift of the one-time $5 million funds to the general fund, from the general fund to the Workforce Development Fund, making these specific funds more predictable with our mission to foster employment and economic growth. This shift would not only secure current client services, but also enhance our capacity to support businesses and with the qualified employees, especially as we continue to face a workforce shortage. Sorry, I'm trying to just shorten my message here. In acknowledging this, while specific mechanisms for House File 4131 differ from the governor's supplemental budget recommendations, it's important to recognize the shared commitment in supporting IPS programs. The governor's proposal to extend the one-time funding is a testament to the need to increase ongoing services and a positive step forward. Work transforms lives. Maintaining access to IPS services is critical for those experiencing mental illness, offering them a path to recovery through employment. I want to close by expressing my sincere gratitude for your time and attention and previous support to the IPS and the IPS model and programs. I'm happy to answer any questions you may have, and provide contact information for follow-up. Thank you.
Thank you.
Yeah, that went fast.
Discussion. Representative.
Oh, I do believe we have some more testimony.
Okay, if we could limit the testimonies, so whoever's testifying, please come up.
Thank you, Chair Zhang.
Welcome to committee. Please state your name for the record, share your pronouns if you like, and proceed with your testimony.
My name is Samantha Manthe. Thank you for hearing us today. I've lived in Minnesota most of my life. I left a few times, but each time I returned, I was in a worse place physically, mentally, and financially. The last time I came back, this time, I was unable to motivate myself to even search for jobs, much less land one. Depression, anxiety, and isolationism had me nearly bedridden. I met my RISE worker, my individual placement and supports, a few months ago, and he started helping me in more ways than one. He helped me refurbish my resume, practice interviews, and dress professionally with the few clothes I had. In a few short months, I landed a job that I love. I work nights, which works well for my sleeping preferences, and I work weekends, which frees up my weekdays to tend to my physical and mental health. Next month, I will move to full-time, which will grant me enough income to start looking for a place to live. But my employment specialist did more than just that for me. He's been a constant encouragement to me, helping me build my self-esteem and improving how I see myself. My mental health has improved because of his gentle guidance. The future looks brighter as we work together and with the rest of my care team to achieve my goals of independence. RISE has been so important to me in all aspects of my struggles. I can't imagine having reached this point without my ISP worker. Please continue to fund RISE and other such services for people just like me who need that extra help to rise again. Thank you.
Thank you for sharing your story. Representative Sencer-Mura, do you have any more testifiers?
I have one more, Chair Zhang.
Welcome to the committee. Please state your name for the record, share your pronouns if you'd like, and proceed with your testimony.
Hello, my name is Sam Munson. I've worked at RISE as an employment specialist in the Individual Placement Support Program since 2020. I did not know about this program's existence before working here, but I'm glad that it does, because I've seen the difference that it can make in people's lives. The funding for the IPS allows us to help people with serious mental illnesses to make progress in their recovery. IPS provides resources for helping people with employment to find and get jobs. It also provides clients assistance dollars to help people to purchase things that they need to pursue their employment and work on their mental health. Sometimes people are in a survival mode and can't focus. Eliminating one or two financial barriers allows them to focus on the bigger goals like employment. Part of the IPS is job development. I will go and connect with potential employers in the community, as employers desperately needing workers, but they don't know how to reach those that are looking in more traditional ways. People like Sam, who you just heard of, came to us. She wants to be financially independent. We worked to discover the type of work that she was interested in, knowing that she wanted to work with people. I connected with an employer, her employer, at a networking event and brought the information back to Sam, where we learned that this would be a great fit for her. As she stated, she can work nights, weekends, and though after interviewing she did receive the job, that was only the beginning. Her work site is close to home, so she is able to take the bus system, but her training sessions were all across the metro. We overcame this barrier by transporting her to these training sessions. Our time traveling to and from the training sessions allowed us to have a productive conversation on coaching, always encouraging her what comes next. I just wanted to quickly wrap up that she started out at part-time, and even before starting the job for her first shift, she was offered a full-time position as well as a $2.50 raise prior to even starting. Thank you so much for your time and the support that you bring us. Sam's dreams have become more attainable to her than ever.
Discussion, Representative Hassan.
Chair Zhang, I do have one more testifier. I'm sorry.
Proceed. Identify yourself for the record, share your pronouns if you like, and please keep it very
I'll be brief. Thank you, Mr. Chair and committee members. My name is Mary Kay Delvo. I'm a parent, a business owner, and a member of NAMI Minnesota. My 24-year-old son had his first psychosis in June of 2023. Prior to that, he was employed. He was an apprentice electrician. He did all the things he's supposed to do in society. The impact of this psychosis on his brain is that he lost a lot of brain function. As a result of that, he can't just go out and get a job on his own. He is overwhelmed easily, has difficulty with memory, has social anxiety and trouble tracking conversations. They tell us this may come back, but it may be 1 to 2 years. With the help of job support, he is able to go out and get a job and work. He wants to work. He's always wanted to work. And there's another component of this, which is, as his parent, I own a small business. He cannot be alone due to his mental health issues for long periods of time, which means I am pulled away from my business, which is impacting my ability to bring in revenue for my family as well. So there are multiple impacts, and stability is the key to recovery. Stability in funding is one part of that, because when programs are pulled from people who are finally gaining ground in relationships and stability, and that money is pulled, that stability is pulled. So I really hope you'll consider supporting this and putting it in your department, in your committee.
Thank you. Representative Hassan.
Thank you, Mr. Chair. Thank you, Representative Sencer-Mura, for this bill. This is important bill. Someone who has worked in this field, in working with people who suffer mental health or mental illness, I know that it's crucial for some of these folks to not just sit at home and be idle. Having a job and having a purpose and waking up in the morning or at night or whatever you prefer, or the weekends, but having a hope and something to look forward to is crucially important. So thank you, and I also love that this program is evidence-based and person-centered, because we got to meet people where they're at, and that is a key in dealing with people who struggle with mental illnesses. Thank you very much.
Representative Nelson.
Thank you, Chair Jong, and thank you for this bill. Mental health is something that, there's an increasing awareness of the need for it, but unfortunately, there is a lack of funding for it, and I think it's in so many ways we have got to address this, and I thank you for this bill, and it's really given, just like Representative Hassan had said, just supporting them and building their confidence, and trying to help them in every way we can. So thank you for that.
Further discussion to the bill. Closing statement, Representative Sencer-Mura.
Thank you so much, committee, for the discussion today. Thank you for the powerful testimony. It was fun to have 3 Sams up here, and it was really great to hear about the positive developments that clients are making in terms of getting a job, securing a job, moving up in their career. This issue is very personal to me. I have a family member who suffers from mental health challenges, and I have seen the difference that having a job, having a stable place to go to every day, having something to get out of bed for has really made the difference for him. And so I really thank the people out in the community that do this work, and I hope that as we, put the omnibus bill together, we can figure out how to make sure they have ongoing funding to be able to support these critical services. So thank you.
Representative Sencer-Mura will renew her motion. House File 4131 be later for possible inclusion. Thank you, testifiers, for being here today. Next is House File 3708. Representative Sencer-Mura will move that it be later for possible inclusion to your bill, Representative Sencer-Mura.
Yeah, thank you. So this is House File 3708, which would provide funding for Equaspace, a nonprofit center that is being developed in St. Paul. This is asking for $250,000 in the fiscal year 25 from the Workforce Development Fund to provide workspace and wraparound services such as IT, accounting, and human resources to small and startup nonprofit organizations. Before coming to the legislature, I was a nonprofit executive director, and I know how hard it was to find adequate space and to really, a lot of people come into nonprofits because they care about the mission. But there's a lot more to running a nonprofit than just the mission. As I know some members on this committee like to talk about a lot of 990s and all of the things that go into that. And so
the Equaspace will really be able to kind of bundle some of those services to support small nonprofits who really have a hard time kind of figuring out, how do I do the human resources, how do I do the accounting with a small budget or a small team. So the mission of Equaspace is to provide a platform of high-functioning workspaces, shared knowledge, resources, and opportunities for collaboration to nonprofits throughout the Twin Cities. They are developing a 16,000 square foot center in St. Paul for 20 to 25 local nonprofits that will bring together about 150 or more employees, and the new space will be open in August of this year. I believe you have a kind of a photo of the building that it's at right off Highway 280 in your packet. There are over 500 nonprofit centers across the United States, including a successful one here in Minnesota in Mankato called Mankato Shared Spaces, which is now in its third expansion. I will now turn it over to my testifiers who can share a little bit more about Equaspace and the work that they're doing in our community.
Welcome to the committee. Please state your name for the record, share your pronouns if you like, and proceed with your testimony.
Thank you, Chair Zhang and members of the committee. My name is Sarah Klein. I use she, her pronouns, and I'm the Executive Director of Equaspace. I'm here in support of House File 3708. As an experienced executive director, a nonprofit center makes sense in filling a gap in capacity building support for nonprofits that complement services offered by Propel nonprofits. The wraparound services we will provide ensure that organizations have what they need to fulfill their operational obligations and in turn can focus on their important programmatic endeavors. Equaspace will be supporting 20 to 25 small to mid-sized nonprofits and bring over 150 jobs to St. Paul via the opening of our nonprofit center in August of 2024. The Equaspace model creates many efficiencies that allow leaders and teams to focus on their mission work. We do this through shared services, as Representative Sencer-Mura mentioned, such as IT, human resources, communications, fundraising, and any emerging needs that arise as we hear from nonprofit leaders themselves. We are here to amplify and create intentional opportunities for them to collaborate and partner to bring more effective service to our community. We will also provide educational opportunities to ensure that leaders understand their obligations and responsibilities as it relates to their nonprofit status, financial reporting, human resources. We know that laws and requirements often change, and it's important for us to bring that information to these small organizations that often don't have the capacity to hire individuals to provide that kind of guidance or support in terms of their operating as a nonprofit. So this support is truly transformational for our nonprofit sector. Thank you.
Thank you. Any other
I
testifiers?
think there's one additional testifier.
Welcome to the committee. Please state your name for the record, share your pronouns if you like, and proceed with your testimony.
Chair Zhang, members of the committee, my name is Ann Leland. I use she, her pronouns, and I serve as the executive director of one of these 20 to 25 nonprofits called Exodus Lending. We work with financially excluded Minnesotans to advance economic justice through consumer lending, community organizing, and advocacy. Since we opened our doors, we've reached Minnesotans across 46 counties, getting people out of 1,000 predatory loans, saving $2.2 million in interest and fees that otherwise would have been drained in predatory debt. We also, it was these Minnesotans that stood up last year to reform predatory payday lending in Minnesota. So that's sort of our mission and work. I'm here in support of House File 3708 because the space we work in, as you've heard, has a direct impact on our ability to deliver our programs and mission. Investing in Equaspace and funding this nonprofit center model in Minnesota will allow us to live into our values of compassion, transparency, dignity, and respect by offering a space that's worthy of the community we serve. Too many nonprofits like this are relegated to offices with no natural light, furniture that's quite dingy, and unwelcome rodents as roommates. And that's how I'm spending my time. My staff, board, and most importantly, participants deserve space that brings them pride and confidence in our work. We're essentially a nonprofit lender, and we want to offer a lending experience that's dignified. In addition to the access to the shared services and opportunities that Sarah described, the opportunity to connect with peers will ensure that we can dedicate our time, energy, and resources to our mission. This work can be very stressful and isolating. You heard from other nonprofit leaders today. The opportunity to be in community with 20 other nonprofits is a dream that can be realized with this support. Thank you.
Thank you. Any further testimony? Discussion to the bill. Representative Harder.
Thank you, Chair Zhang. My question goes to the Executive Director, Sarah. I'm guessing that this is the first time that you're coming to request a grant for your program. And my question is, you can answer that one. My second question is, who else are you partnering with that you're receiving funds to help assist in the development of your program? Thank you.
To the testifier.
Yes, thank you for the question. Yes, this is the first time we're asking for funding from government. And since our founding in 2018, when we were incorporated as a 501c3, we've been funded through individual donors and foundations.
Representative Harder.
Thank you, Chair Zhang. My next question, my final question, are the people that you're partnering with also increasing their donations? Are you requesting that, or you just want to rely on the taxpayer dollars to fill in that gap that you have? Thank you.
To the testifier.
Thank you for the question. Yes, we are ramping up our fundraising efforts to ensure that we have the resources needed to open our center in August of 2024. Thank you.
Representative Harder. That's all. Thank you. Further discussion, Representative Weems.
Thank you, Chair Zhang. Thanks, Representative Sencer-Mura and Ms. Klein. The goals of workforce is really job placement, to train folks for whether it's skills that we have a shortage in, which is in the medical industry, the trades, also public safety, and also for specific disabilities, the blind, and special populations, especially those refugees and new Minnesotans that are coming. I have a little bit of a concern, because I think I heard this from the other testifier, that this is a nonprofit lender, or it is in the business of being a landlord. And I'm not certain that is in the purview of the workforce, in the sense of job placement, training and job placement, and a livable wage, so people can have the dignity of buying their own home and having independence. Kind of an expansive question. So I'll ask if Representative Sencer-Mura can say, how does this relate directly to workforce? I don't have a problem with the overall ask piece, but I don't think this really fits into workforce.
Yeah, thank you.
Representative Sencer-Mura.
Thank you for the question. So I think first I just want to clarify something. So Equaspace is the larger nonprofit center, right, that will bring together over 25 local nonprofits. One of the nonprofits you heard from was Exodus Lending, that specifically does lending. So that's the specific kind of mission and work of Exodus Lending. There will be 25 other nonprofits that have different missions, so it's not like everyone is doing lending. So just want to make that clear. You know, and what I will say is that we know that these nonprofits bring over 150 jobs to our community. We know that nonprofits, one of the things they really struggle with, I think, is how to have efficiencies, and I know that that's something that you care about, and I think sharing space is an efficiency that can ensure that we can keep these jobs in our community. You know, I know from working in the nonprofit sector that one of the most heartbreaking things year to year is how are you going to make your budget, right? How are you going to be able to fulfill your mission, keep the jobs for your staff? And we do see this kind of churn and burn of nonprofits where it just, the fundraising becomes too much, the expenses become too much, often rent is too much, and they have to shut down. So I think this will bring some stability to the jobs in the nonprofit community, and that's how I see it related to workforce, but also, you know, open to having my testifier give her opinion as well.
To the testifier.
Sure, thank you for the question. I just want to clarify something with Exodus Lending as a nonprofit lender. They are a nonprofit organization that provides loans to individuals that have engaged with predatory lending. And so they are working outwards to the community. They're not lending to other nonprofits. And so just know that they're doing really good community work in terms of the support that they're providing to community members. I would also add that broadly, when you think about workforce development and training, we need effective nonprofit leaders in our community to ensure that, as I mentioned, that they're aware of all of their obligations. Running a small organization is difficult, as Representative Sencer-Mura mentioned, being experienced in that space. I have also run several small organizations where the responsibilities that I'm beholden to are not different than any of our larger organizations that are well-resourced and can hire individuals to do HR and accounting, IT support, those kinds of things. And so by creating those efficiencies in a nonprofit center, we can ensure that many of our small startup nonprofits have the resources that they need to do all of the things that we're asking of all of our organizations, and for them to be able to, in turn, do really effective and important work in our community.
Representative Harder, Representative Weens.
I'm very close to being harder, but I think hardest. So thank you, Chair.
I saw her name's next on the list, that's why.
Thank you for those answers. And I'm just one last thing on this, because I don't doubt the ability that you have to impact your community. It is really the efficacy of how we're going to spend $250,000 of taxpayers' dollars. How many folks will be job trained with that $250,000?
Right. Every single employee.
Fire.
Thank you. Every single employee that is part of an organization that becomes a tenant. So, with 20 to 25 small to mid-sized organizations, we estimate that that's over, I think over 250 seats if we talk about individuals within every single organization, knowing that, we're in a hybrid environment where some of these organizations have folks that are not in the office every single day, but you think about that rotation in total, those are probably the numbers we're looking at in terms of this particular center and the access they have to folks that are experts in a range of areas.
Representative Weens.
So just so I understand, basically it's training for people that are already employed in the nonprofit sector.
Correct.
We're not placing new people in with this.
I would say it's both in that it.
Sorry about that.
I would say that it's both in that it provides opportunities for many of our small organizations to expand and grow. Exodus Lending, for example, is slated to double in size in probably the next year in terms of just being able to provide their programs to the folks that need it in our community.
Representative Harder, are you still next?
Thank you, Chair.
Yes, thank you for allowing me to ask one more question. I think this is more of a yes or no, but I'm just curious as to who can answer this question. Are there reporting requirements with this grant back to DEED?
We have staff where I know that DEED does mandate a report every year, so if someone from DEED is here wants to. Oh. Welcome to the committee. Please state your name for the record. Share your pronouns if you'd like, and proceed. Answer any question.
Thank you, Mr. Chair. Nathan Ratner, Department of Employment, Economic Development, Government Relations, and he/him. So per the grant requirements that were passed into statute this past session, there is a requirement for reporting annually for special appropriations. So we would get one that we would then share with our committees of jurisdiction.
Representative Harder.
Perfect, thank you.
Further discussion to the bill. Thank you to the testifier. Seeing none, Representative Sencer-Mura, would you like to make his closing statement?
Yeah, thank you for the robust discussion today. Would love to continue the conversation, Representative Weens, and I think we talk a lot about our relationship between government and nonprofit, how nonprofits fill in a lot of the areas where government is not able to be as effective, and I know that we all care about making sure that nonprofits have as many efficiencies as possible. So thanks for the conversation. I renew my motion to consider this for the omnibus bill.
Thank you, Representative Sencer-Mura. Next is House File 4080. We have Representative Olson. Welcome, Representative Olson, to the committee. I will move that House File 4080 be referred to the Children and Families Finance and Policy Committee. Welcome to committee, Representative Olson, to your bill.
Thank you, Mr. Chair. House File 4080 is a bill that would have an immediate and lasting impact on the workforce of the city of Fairmont, especially in Martin County, Minnesota. What we are currently seeing is about 5 years ago, they began an expansion. The Lakeview Methodist Home is a senior living center that also has a child care center within it. About 5 years ago, they began a massive expansion project to rebuild their facilities. They were aging facilities, and to expand their child care facility within that building. Then in 2020, the pandemic occurred, which then drastically increased the cost. They had secured all the costs of this facility. They were going to have it done the right way, on time, on their own dime. And then costs expanded drastically. And now Lakeview and the city of Fairmont are sitting in a position where we desperately need child care. And this is the one way in which we can do it. We've attempted, our charity has increased. We've received donations, but as you all know, the cost of building in the state of Minnesota has increased at a rate that exceeds the amount of money that the charities are able to bring in. So it's kind of like we're running backwards and treading water and slowly drowning as the charity money comes in and the cost increases as well. So we're here asking for the state of Minnesota to give a one-time, only one-time amount of taxpayer dollars to drastically expand our workforce in Fairmont. I have the executive director here, Deb Barnes from Lakeview Methodist Home.
Welcome to committee. Please state your name for the record, share your pronouns if you'd like, and proceed with your testimony.
Yes, Deb Barnes, Lakeview Methodist Healthcare Center, and our representative graciously told you the story. We brought child daycare onto our campus in 2017 when they lost the lease to their space, the space they had. The city then came to us in desperation, in crisis, because to lose the only child care center in Martin County, in Fairmont and Martin County, would have been extremely devastating. We then opened space on our campus. It became a wonderful addition to our residents, so we are committed to keeping it. We have $1.25 million invested into this space, but between the beginning of construction and the end of construction, the prices rose by another $1 million+. We've been able to, as a representative said, we've been able to collect about $360,000 from donations, but we need another $1 million. I will defer to Shay.
Representative Olson.
Thank you, Mr. Chair. I have one last testifier, the individual who's in charge of the child care center there in Lakeview.
Welcome to committee. Please state your name for the record, share your pronouns if you'd like, and proceed with your testimony.
Thank you, Mr. Chair, and good morning. My name is Shay Ripley. I'm the owner of Building Blocks. As Deb stated, we are the only child care center in our county of Martin County. Like many other areas across Minnesota, we are facing a severe child care shortage. What isn't talked about enough is that childcare is the workforce behind the workforce. We receive phone calls daily from people looking to enter or re-enter the workforce, some looking to relocate to our area for job opportunities. Unfortunately, we have to turn these families away because we simply do not have the physical space to take on more children while continuing to provide the high-quality care that we believe in. We are also experiencing a workforce shortage in our county, like across Minnesota. The two go hand in hand. Our center provides high-quality care to 50 children currently. Many of them are low income. In the new facility, we would be able to immediately double our capacity. That would potentially get up to 50 additional people into our local workforce. With this bill, we could finish the space that was started and get people to work while they have peace of mind that their child is well taken care of. Thank you for your time and your consideration.
Thank you for your testimony. Further discussion to the bill. I see Representative Weems. Are you going to go ahead?
Mr. Chair, I will. Okay, it's a secret sauce question. Executive Director, Lakeview Methodist, how do you maintain such a crazy high charitable giving ratio? You've got to go.
To the testifier.
You have a relentless foundation director who is constantly putting our needs in front of the community. We are religious-based, and so we have the support, not as much as we used to, but we do have a strong church base, about 18 churches that started our campus in the 1960s. Fairmont is also a very family-oriented community, as is Martin County. So as the need is presented, people do come forward as they can, not, however, to this degree.
Representative Weems.
Thank you, Mr. Chair. Thanks for your good stewardship of all of the people of, I guess, Martin County. And hopefully this $1 million will help you get that child care center set up and serve the population. Thank you.
Representative Zalesnikar.
Thank you, Chair. Thank you, Representative Olson, for bringing this bill, and thank you to the testifiers. Did I hear you correctly? This is the only child care center in Martin County. I think you have almost 20,000 citizens. Is that correct? Did I hear that right?
Yes, that is correct. There are a few, pardon me?
Proceed.
There are a few home care providers, but we have found, or Shay has found, that home care providers start, and then when their own children go to school, they go out into the workforce on their own. So Shay can speak to that more eloquently than I can.
May proceed.
Yes, that is correct. We are the only child care center in Martin County. There have been efforts of other hopeful entrepreneurs hoping to open centers. It's just the market and it's just not feasible as a job opportunity, to be honest. So we're very lucky to be partnered with Lakeview. We have a really great partnership. And it's been working great. So to expand our capacity would be huge for our county.
Representative Zalesnikar.
Thank you, Chair, and thank you for that testimony. I think this is a great use for workforce dollars. I sit on children and families. I 100% agree. Without childcare, there is no workforce. And so I think it's phenomenal to see an intergenerational program. Having been in that space my entire life, it's a win for the entire community. When you integrate these ages, the ability to have so much more than just the educational program for the kids. It's bringing people together of all ages, and then being able to serve the community for people that are working in healthcare, where we just have a double prong issue, so that we can make sure we have caregivers and that they can care for their family too while doing this. So commend you for the efforts. I think this is a fantastic use of resources to build stability in communities where we need to put the resources so that we have childcare and good programs for our children. So thank you.
Chair Hassan.
Thank you, Mr. Chair, and thank you, Rep. Olson, for bringing this bill. We know childcare is a real problem in our state. I know Deed is in the room. I would like to ask, I remember last year we gave $13 million for childcare, and this project may be a perfect fit for that. Is that something that that can be worked with Deed instead of going through the legislator? I don't know if Deed has comment on this.
Could I just make a comment on that?
Hold on a second.
Okay.
You can both come.
Welcome, committee. Please identify yourself for the record, your pronouns we like, and proceed to answering a question from Chair Hassan.
Thank you, Mr. Chair. I'm Haupei Lee, Legislative Liaison with Deed. To answer your question, Representative Hassan, I think we are open to having that conversation. We do have the Office of Child Care and Community Partnerships now, and so we are more than happy to have a conversation and partner with that.
Representative Hassan, I think that's why we're sending a bill to the Children and Families Committee.
Okay, that's where it's going? Okay, all right. Well, thank you.
Representative Brand.
Thank you, Mr. Chair. That was exactly my question. I was going to ask Deed for that exact thing because I know last year in capital investment, we had $900,000 for childcare as well. That is also another opportunity. I hope that maybe partnering with the city or the county, maybe there's money to access for that as well.
Representative Sencer-Mura.
Thank you, Chair Zhang. Thank you so much for bringing this bill. I really appreciated the framing of saying, childcare is a workforce behind the workforce. I think that's really true. I just kind of wanted to connect it to some earlier conversations we had about what are the best use of workforce dollars. And I think, while I don't see this bill as fitting the really narrow definition of job training, I think our committee should think more holistically and creatively about what are the barriers that keep people out of the workforce, how do we keep people in the workforce, and I know as a mom of a 2-year-old that childcare is is a huge part of that. Childcare was the reason I was late today, right? And so I appreciate this bill and I support it. Thank you for bringing it.
Further discussion to the bill. Seeing none, closing statement, Representative Olson.
Thank you so much, Chairman Zhang, for hearing this bill today. Thank you to the committee for giving it an opportunity. It truly is an immediate way in which we can increase the workforce in Fairmont, Minnesota. It's a desperate need, and it's one of those in which it would be one-time money. The state would jump in and help out an organization that did it the right way, but just got hit with something, a once in a 100-year pandemic that ruined their plan. And so I think that when you do something the right way and something unexpected occurs, when the state has the opportunity to, they can jump in and they can make it so that people in Fairmont, Minnesota are able to succeed and thrive, as well as just about any other state or city. So thank you so much, Chairman Zhang. Thank you to the committee for hearing this.
I will renew my motion that House File 4080 be re-referred to the Children and Families Finance and Policy Committee. All those in favor say aye. Aye. Opposed? Motion prevails and the bill is on its way. We have no more bills on the committee for today, but we still have several bills. And so we are going to meet, hear a few more bills next week, then we'll be on break, and then we'll come back, hear more bills on the 3rd of April. Then after that, we will likely have our draft bills. So if you are watching, lobbyists, advocate folks, if you have a bill that hasn't been heard, if you want to be heard, you better get it in because our committee is getting very packed. We don't have any more hearing time. We want to meet once a week, and we're going on break. And so April 3rd will likely be our last time that we hear bills. And so with that said, nothing on the agenda. The committee is adjourned.